Daily Show on a Tuesday morning, 10:32 is the time, and with our friends at Associated Physicians Group. No Dr. Green today. We have Mike Babinski in here, man. Nice to have you in the studio, and really excited to talk about, HRT and really getting to understand this better. Because, I love topics like this when it comes to just the local talk show component. It's something that's complex, but really can be broken down, I think, and it really just showcases why, APG goes above and beyond and is really just stepping up for so many in the area.
Yes, that's what we're trying to do right now. And we brought this on about a year ago, and we've got it launched off the ground. And it's a component of our primary care kind of program that we do with Dr. Green. He might have mentioned it before. But basically what we're letting patients tell us is, tell us your symptoms. One of the questions you may want to know is, well, who makes a good candidate? Well, the people that make the good candidates are, how have you been feeling? You're going to do a lot of, symptom checking, chronic fatigue, afternoon tiredness, low libido. That's a big one we see.
Yeah.
Decrease in muscle mass, inability to recover from workouts for a lot of the guys. Women, you start having those menopausal issues like night sweats, just not feeling right. Something feels off. We run blood panels, extensive blood panels that check just about every nick and cranny of the metabolic panels, blood work. We dig deep into that, and we see what we can correct, and if they're good candidates that way.
Well, and see, this is, I think, what I find so fascinating is how many people, generation upon generation, go through that in life where it's, man, something just ain't working. I'm slowing down, or is it I'm getting old? And, the myriad of issues that come with that, whether it's, psychological, or you have strains of relationships caused because, we're just getting, what have you seen just in your time working, within, hormone replacement therapy, of just watching maybe somebody's life kind of retransform, back into, that old self? Because to me, that's the most valuable part of any job, is to see that turnaround.
Yep. This is a great question. I had 2 people that returned to me already this morning, ladies, that have gotten it, that have gotten pellets done, and their lives have transformed. They feel themselves again. And one of them, was almost in tears, saying like, this has just made such a huge difference. I feel like myself. I'm loving my husband more. We're together now again more often, and things are great. And here he is in the corner with a grin on his face.
Yeah.
That's what you want. That's when you've connected. And you hear, and this happens time and time again. And the next question, usually from the husband, is, can I do this too? Absolutely. Yeah. Let's start with that blood panel. Let's see where you're at. What symptoms are you having? And you just keep going on, and you keep helping.
Well, and let's dive into this, because I feel like, hormone replacement therapy, just like so many other things that really have, I think, helped so many people get mixed attention, or maybe just, and it comes with confusion.
Oh, yeah.
Where do you think, why do you think there's so much confusion around, I guess, just this sector of health?
There wasn't much research on it. And what we thought was, well, for guys, testosterone is going to cause the blood pressure to shoot up. It's also going to cause your blood to get thick. You could get a clot. You could also have prostate cancer. It's going to immediately cause prostate cancer. Well, we know now that's not what the receptors are telling us in the prostate. We actually, if you're low, you're more susceptible to having PSA levels start to rise. Yeah, because it will start to inflame. It will start looking for the free testosterone that it needs. For women, you start to thinking, well, you're going to get breast cancer. You're going to have uterine cancer right away if you start giving yourself testosterone, estradiol. This is not good. Well, now we know. And if you ever hear a podcast from like Dr. Gabriel Lyons, Dr. Huberman, we know, keep muscle on you. Yeah. Instead of going through all these treatments for, osteoporosis and all this other stuff, and all these also menopausal symptoms, we can correct it a lot of ways with looking at these hormones and then correcting those levels, getting up to your high levels where you used to be, and you start feeling better, and you don't have all these issues.
Does it, I don't want to say the word scare, but does it just enlighten people or kind of blow them away that medicine's at this point? Because to me, it almost seems sci-fi-esque, where it's such futuristic medicine that you can really pinpoint what to target.
Yeah, well, they're starting to peel back the regulations on this, and I think we're going to see coverage for women in a lot more of these areas with pelleting gels.
That'd be fantastic.
No, it's going to be huge. It's going to be very huge for them because they're suffering right now, and they don't know why. They don't know what's going on, and they're told by a kind of an old, kind of the old style medicine. And they go into their primary, who's on the verge of retirement, and let's not deal with this, and they don't even get levels ran. So they come to us and they start seeking other help from everybody else, saying, what is wrong? nothing. It's not normal how you're feeling, but we're going to make you feel normal. That's what we're after.
Well, and I think, for someone even like me, and this is where I kind of tie it back in just from, being empathetic, if you're in that position where it's like, man, I've been tired all the time. I have this going on, X, Y, and Z, kind of those common ailments. So many times I've had, interviews about, illnesses and disease. A lot of them start to sound like, man, do I have something serious going on? And then it creates that, for me, it creates a stress because I'm a hypo, confident,
Oh, sure.
What am I going to be okay type of thing.
Oh, absolutely.
I just find that fascinating. So to really, I think for some people have this be such an eye opener of, wow, here's where my levels are. And no wonder
I feel so bad.
Right.
Yeah.
It's just, to me, that's where it blows me away, where it's something so simple.
Oh, yeah.
But it's still not simple.
I had a 45-year-old guy ask me if he had mono. He feels like he slept all day. I said, no, you don't have mono. I said, your free testosterone, your total testosterone's in the toilet. And it's so low, you feel horrible all day long. He's like, this is terrible. Now, I think that was an interesting case, but I recently had that conversation.
Fantastic. Well, just because that to me would be something that I would personally exhibit or go through if I was in that position. Now, how is it different, this modern approach, different from maybe hormone therapy, different to maybe what was done years ago? Has there been some innovations there or just some different work being done?
Well, I think the best ways, I always tell patients this. There's a few different ways we can do this. For women, if you want to go to your OBGYN and kind of look through the creams and gels or even the kind of the vaginal inserts, we can do all that. What I like to do for patients is talk to them about pellet therapy. I think it's the best delivery out there in terms of being compliant. It's a slow dissolving testosterone pellet, and it dissolves over, for women, 4 to 5 months, for men, 5 to 6 months.
So I was going to ask you about that because you keep referencing that multiple times. And so is it one of those things you'd only take it, that one time, or how does that work?
It's through intervals, through pelleting. And then also injections are more frequent, and creams and gels are a daily application. And not to get too deep in those, but in terms of the pelleting, which you're asking about, it is implanted into the left upper hip areas for women a lot of times. And for guys, I like to focus on the flanks. We usually tend to be a little meatier back there, and that tends to be a little less damage to the tissue because it is an implant. I use a small blunt tip device that implants, and I just kind of make a baseball field kind of approach, and I just kind of place pellets at third, short, second, and first. And over time, these burn. After about 2 weeks, they start burning, and you start feeling amazing. And that's what I always hear from my guys. I noticed I was waking up. I'm 55. I woke up with an erection today. I'm like, yeah, that's it. We're cooking now.
Welcome to normal.
Yeah. That just happened this morning. It's like in this category, it's been great. My wife's really happy. I feel like I'm back. Perfect.
Do you have to keep doing it over and over? Like, is it
the pellets aren't going to last forever. What it's going to be, the interval is usually 5 to 6 months for guys. We repellet you, and we watch labs on this. We watch this extremely close.
That's what I was curious about.
It is we watch all levels very quickly. So when you're first time pelleting as a guy, you're going to get labs at the 4-week post pellet, and then at the 18th week, and we look to then pellet you at the 20th week. And if the levels are still pretty high, we push it off for about a month. Same thing for women. We do, it's about a 16-week interval. So we do pelleting, we do a pelleting date, post-pellet labs are after 6 weeks. And then at the 14th week, we take what we call a trough lab. And then we look to pellet again on the 16th week. If the levels are up, we push it out a month, and then we do it about every 5 months.
Well, and I feel like this is such a basic question, but I still think it's an important one. Why are our hormone levels so important as we age? Just to break that down.
So what we know now is the benefits are through cognitive benefits, cardiovascular benefits, muscular benefits. All of those things tie into a huge, health picture that you have. And if you can get these things right, and most people that have these low symptoms are good candidates for hormone replacement therapy, we can get you feeling really good, and you don't have a lot of the ailments. I've had patients that have lost up to 65 pounds over the course of a year, and they're off their blood pressure medication, they're off their cholesterol medication, they're not doing any of the other side effect medications that these other medications are causing. So it's almost like you kind of clean house on a lot of these issues, and the patient's really happy about it because they're not spending all this time in the doctor's office and they're feeling good living their life.
When their doctor's probably happy about it too.
Absolutely. Absolutely. You see it over time.
So, I want to just jump into this too. Does age matter? What age ranges do you start to see when it comes to hormone replacement therapy? Is there really a set age where this could start to affect individuals?
So you can have very young people have issues in the male, but a lot of times that's when we need to go look at, maybe do a referral first to urology, see if there's something else going on a little more complex than just the hormones.
Okay.
But what we also want to look at is if I've got a 35-year-old male, and that's really when I start to kind of really look at treating the issues 35 and above. What do we have going on? I always want to look, do we have a sleep apnea issue? You want to check for some general things first before right to hormone, because it may not be the answer for everybody. But for a lot of cases, the guys that are having issues, which is feeling tired, weak, joint inflammation, they ache, they go to a recovery, they work out all day, they lift a little bit of weights, and they're sore for 2 weeks. That's not right. You need to be able to recover better than that. We're going to look at the hormones and the free testosterone level to see what's happening. Yeah. And that's typically treated pretty well. Women, same kind of deal. We're looking at, we got to be delicate with perimenopausal women, but postmenopausal women and people that have been out of the menopause for a while, those are great candidates if they're having those night sweats, anxiety at night, can't sleep, insomnia issues, and just abnormal weight gain. That's what we start looking at.
I really like the emphasis on safety, though. And because I think so many times that might scare somebody to newer medicine because it's like, what if if this is just the catch-all, if this is whatever it is. So to really go into that knowing you aren't going to a different and somebody else that's going, all right, let's just give you the number 5 special. Yeah. You're going into being seen by you guys at APG who really know what you're doing, have a great network, and really, I think, just because of all the different individuals you work with work with so many different backgrounds and different types of people, you really have a keen understanding. And it's not about just throwing this on you. It's about what works best for that person.
It's taken a while to learn a lot of it. Yeah. It's taken a while to get very good at knowing what to watch. But if you came in and you had a friend that did it too, your cases, and you said, well, I took 10 to 200 pellets. Your friend will say, well, I took way more. Every case is going to be different. Yeah. And it's not cookie cutter. It is individualized. And we're going to pull certain labs for certain people. We're going to pull certain parameters and give them advice on what they should do for supplementation. Not everything's going to be treated with a prescription. Yeah. We're not going to try and do that. It's going to be more situated towards a little more functional medicine where you're going to get people feeling well a natural way. And just not to supplement, we're going to correct, and we're going to make sure the symptoms are getting managed and resolved, and then maintaining those hormone levels to keep any further issues from happening.
I'm just so fascinated by this because I can only imagine the turnarounds for so many people that, especially, the thing that would bother me more than it is cognitively, hey, things aren't, if I'm slowing down and I'm not thinking as fast as I used to, and I'm only, 55 years old or, that gets scary. And, just to see the turnaround time on that's interesting too. I wanted to go back though, because you're talking a little bit, maybe like 200 pellets or whatever you had or. Yeah. Yeah. What does the normal timeline look like? And I know I hit on this earlier, but so after you start getting seen, you get your pellet, 4 to 5 months, that timeline goes. How often do you go back and check levels? After if let's say levels are still great, you don't need to get another pellet. Do you go back every 3 months? Is it every 6 months?
Sure, yeah. So how we do this is we will pellet you on the first time pelleting person, guy or girl, it will vary. Guys, they're coming back to us after 4 weeks. Now those pellets, once implanted, they're going to sit for about a week and then they start to burn. And that level rises at around the second week and you start to notice it. Okay. And then by that 4th week, we want to see that those pellets are burning and we'll see very elevated labs. And that is not to alarm patients. Yeah. That's what we tell them. This is right. This is what you're supposed to see. Women, same thing, but it's about a 6-week post-pellet.
Well, and now after the pellets, so if their labs are looking good, you don't necessarily need another injection, correct? Or another implant?
Yes. So women. So I watch this. So for women,
that's what I was curious.
At that 14-week level, if that total testosterone level is very high and the free is very elevated above, I'm talking more than 5 points free, and the total testosterone is way above 100. I'm holding off for a month. I want to get you more closer to the 75 total testosterone range for women. Guys, I can kind of play with depending their symptoms, if anything has been resolved or is still happening on. But it just is, it's remarkable. I'm so glad I got into this after 5 years because it's fun medicine. You see the results.
Well, and too, it's one of those things where, I mean, to me, it's truly transformative.
Yeah.
Because there's no doubt, I mean, we've all seen the individuals that you know, are maybe I know folks that are 75 and can outwork me and go and party with the best of them still, and I also know folks that are 55 and you know, we've all seen the quality of life that's there for some.
Oh, sure.
And so, you know, really to be a part of that for somebody and give them that renewed lease on, oh my God, there's a part 2 to this. That's awesome. I mean, that's an everyday buy-in for me.
Oh, absolutely.
Yeah.
Absolutely.
So going back into this too, we were talking a little bit about, you know, the process and the safety, how you monitor and the levels of follow-up. You know, what are some of the common side effects? Is there anything that we kind of need to take into account if we have, you know, any pre-existing, you know, conditions before we give you the phone call?
Oh, sure. Yeah, sure. A pre-existing condition, you know, if we watch for certain parameters for like guys, you know, if once you get pelleted or you do injections or creams or whatever, you know, do you have, like with creams, do you have any of skin irritation from that cream? For injections and pellets, do we have hair loss? Do we start having a very high blood pressure, a hematocrit level that's too high? We look at all of those issues and can correct very quickly on those. Fantastic. Same kind of goes with women, you know, but with, you know, specifically talking about pelleting, there is a little more trauma to put them into the body. So you watch for site infection, but I've not had any issues though, because we use a little bit of antibiotic ointment and we don't have any issues at that site.
Are you going to have some irritation?
You may have some site tenderness, but women do great in this. They heal after 3 days. Guys, it takes 7 days, and that can be a little bit of a drawback where you got to stop the weightlifting for a week. Yeah. But take that recovery week. That's actually still good for your body. Yeah. Hydrate yourself, take the creatine you need, recover, and then get back to it after that healing time, and you'll be great.
Well, and you know, we talked about when patients normally start to see improvements. Has there been I shouldn't say a generic, but like a catch-all for turnaround time? Because, you know, you start to feel it, you know, in a couple of weeks in. Is it, you know, week 4 you really start to go, oh, here everything's coming together? Or
you really start to notice this after about the second week. You can start to feel it a little bit.
That's what I was wondering.
And then after about month 2 in your progress, you're like, oh, you know, I hear it all the time, especially from the women. My night sweats resolved. I feel just so much better. Like, this has been great. I have energy to do things. I'm not having issues sleeping. Everything's working out great. Guys, it's you know, we're thinking of different things. Yeah. I'm recovering better at the gym. Things are working again down south. And then it's like, can my wife do this? I need to catch her up. It's like, we got to see labs, but absolutely, you have that option. Yeah. So couples got to have that conversation with each other, which is, you know, how's it going to work for both of us? That's a good one.
What surprised you the most about these outcomes, I think, is the question I have for you before we start to wrap up.
So what I've seen that has shocked me the most is the benefit that women have with getting rid of the menopausal symptoms for women. It happens quickly, and it does. I've had very few women have any side effects, if any, have any issues with the pelleting.
Wow.
Not many on injections. That's a little bit risky for me. I don't like getting into that for women. Guys, the best things that you hear is, I feel like I'm 20 again. Yeah. This is how I've wanted to feel for a long time, and I no longer am taking a nap from 3 to 5 in the afternoon. I'm no longer feeling like I could fall asleep at my desk at that 2 o'clock meeting or conference call. It's like I can keep going, and I'm at 9 o'clock. I still got energy to spend time with the kids. It's like awesome. That's exactly what I want to hear. So
before I let you go, let's wrap up with this. Who is the prime candidate if someone's watching right now and goes, you know, maybe I need to give Mike a call? What's
sure?
Look like?
Yeah, to come see us over at APG, right? So you are a candidate if you are out there and you are dealing with chronic fatigue. You feel weak. Things are starting to soften quite a bit. You don't know why. Maybe your diet's on par, and and it's like, why am I still continuing to gain weight? Are my cortisol levels up? We're going to check that. Yeah. Am I having issues? So, you know, what could I be doing? Is it a medication I'm taking? We're going to come and we're going to look at that. So you're a candidate if you have all of those low hormone type levels, you know, for women, the night sweats, clarity issues, loss of libido is a huge one. They don't like that. That causes a lot of problems. Inability to recover. So that's what we look at. And if that's you out there, you need to get your blood drawn, have specific parameters drawn. A lot of times primary care can't get them across or covered. So you got to go to one of these clinics and actually pay for a set of labs, which is still a very smart decision. And then start looking and investigating. It's not normal to feel completely worn down all the time. And stress can be a big part because we all live very busy, stressful lives. It weighs on us. But a lot of this is not normal. We need to correct it, and you're going to live a healthier, better life.
Fantastic. Yeah. Now I got to ask you a fun one because your patients are going to be watching this in the waiting room too. What should they have done before they got to your appointment today?
We need a blood panel. We need a call. As soon as we do that, as soon as we get a call and you're interested, we want to get a blood panel to you. We can send it to anywhere between Health Lab, LabCorp, Quest. I can't really do the hospitals, but LabCorp, Quest are big ones. Those give great results. Health Lab is another one we use. And we go from there, and we get a symptoms. We do a protocol of a kind of an outtake form. I look and see what the main issues are, and then I match up with the blood work, and we start going from there.
Fantastic.
And I tell you the plan.
Thanks for stopping by and joining us.
It's been a great
fantastic conversation.
Yeah.
We'll link everything in a write-up on RiverBender.com. Highly encourage you to give Mike and the team at Associated Physicians Group a call today. We'll link everything in a way to do that right there on RiverBender in that article. Taking a quick break and wrapping up the show next.